Welcome everyone to another Dow Labs webinar. This is called Novel Virus Ancient Therapies. Can Chinese Medicine Help Contain COVID-19? So we're in the midst of a pandemic and just announced by the WHO. And so this is on everyone's mind. And so we want to talk about what's happening with COVID-19, both in China and now in the world, and how we can think about it with Chinese medicine. So let's just take up that first question. Can Chinese medicine treat COVID-19? So we'll start with our first slide here. You may or may not be following the news too closely from China, but there's really a fair amount of sort of anecdotal evidence coming out of China that Chinese herbal remedies are playing a really important role in managing the coronavirus outbreak in China. We're not getting that in our popular media, but certainly I'm getting that from friends and colleagues who live in China. And so, and maybe a little bit in the Chinese medicine sort of media. But I think this is a really interesting situation. And in order to think about it a little bit more, I want to talk today about some of my research on basically a very much related issue, but a bigger one, which is really, can Chinese medicine treat acute illnesses in general? And this is actually has been a real debate in China. So let's just kind of start with some perspectives about Chinese medicine from just in general outside of China. And in the world, at large, as many of you may know, there's not a lot of familiarity with Chinese herbal medicine. This is what's being used primarily right now to treat coronavirus in China. And there's, a fair amount of ignorance here in the US and in the West. Most people may only be familiar with acupuncture, and they tend to think acupuncture is Chinese medicine. They know that acupuncture is good for a few specific conditions, perhaps chronic pain, emotional disorders. Patients always say acupuncture is relaxing. They may know of a recent famous study about treating a fetus in a breech position with moxibustion. But in general, Chinese medicine is sort of thought of as alternative medicine in the US. And there isn't a wide recognition of Chinese medicine being effective for too many things. Inside China, there's kind of a very different story. So let's look at the perspective inside China. And so Chinese medicine is certainly recognized and appreciated by many people in China. But there's also many who don't go to see Chinese medicine doctors. There's really two different systems of, there's sort of two parallel healthcare systems, if you will. There's sort of like a Western medicine healthcare system, which is the predominant one in China. And then there's the Chinese medicine system, which is a good bit smaller, probably 1/5, roughly the number of doctors and hospitals and all that. But if there's a rap on Chinese medicine in China, it's thought that Chinese medicine is slow. It just is slow acting. Things take time. And it's therefore really only appropriate for treating chronic conditions. And on the right here actually is a picture of the ER at the hospital where I did some training in China. So and those of you who know me may know that I've did my medical training at the Beijing University of Chinese Medicine in the late 1990s. And this is the hospital where I did a lot of my clinical training. And there's a little shot of the ER there. If you were to go to the ER, you would find in a Chinese medicine hospital that it's primarily Western medicine. The vast majority of treatments and the doctors may be Chinese medicine doctors, but the things they do are basically Western medicine. And that's partly because Western medicine is thought to be essential for treating acute illnesses. And we can kind of see this, we can sort of see these clinical tendencies just in the way people talk about Chinese medicine, but also just in some of the way doctors work in their clinical practices. So the phrase that you always hear people say is that Chinese medicine treats chronic diseases, Western medicine treats acute diseases. And then if you were familiar with some of like the most famous, and these are doctors with national reputations, several of them have sort of died in recent years, but you can see their reputations are really built around the treatment of chronic illnesses. So, for example, Zhao Shude is a famous doctor, was a famous doctor in Beijing, died just a few years ago, nationally famous for his treatment of rheumatoid arthritis and many other things. Zhu Liangchun is a famous doctor in Nantong. That's not too far from Nanjing and Shanghai, that region. Also very famous for rheumatoid arthritis and the treatment of cancer. Deng Tiatao, very famous doctor in Guangzhou, known for treating myasthenia gravis. Zhang Qi is a well-known doctor in Harbin in the Northeast, well known for treating chronic renal insufficiency. So these are all diseases that they're experts in treating, but things that take weeks, months to deal with, and you may never totally get cures in some of these with some of these conditions. You just may sort of get a reduction in symptoms. So at the moment, what I'd like to do today is talk a little bit about some of my research, and that involved actually meeting several of these doctors. And one of the surprising things I learned in this research was that Chinese medicine actually is quite good at treating acute illnesses. So let me just tell you a little bit about the research and some of the doctors I met as part of it, and what I learned. So I've got two separate research grants to help me to study this issue in 2009 and 2011. And actually the original issue was not so much to learn about the treatment of acute illnesses, because I was not even aware that this was important, but I wanted to learn about how Chinese medicine doctors were trained and how they practiced medicine before the communist era, which means before 1949. So at the time, I was able to conduct oral histories with 39 senior doctors. All of these individuals trained in what's known as the Republican period. This is this era from 1911, which was the end of the Qing dynasty, to 1949. All of them were quite elderly at the time, in their 80s and 90s, and as I said, sadly, many of them have passed on since I've interviewed them. But one of the surprising things I discovered in these interviews was that when I started asking them the sorts of things they did in their clinical practice in these early years, they all talked about the treatment of acute illnesses. And in fact, many of them said this was considered sort of the strength of Chinese medicine before 1949. So down in the lower right here, we see this physician Zhang Qi from Harbin, and he kind of told me quite flatly, said, if you wanted to become a famous Chinese medicine doctor in this era, you became famous because you were treating acute diseases. So here's in the next slide, I've got a few quotes from some doctors about various doctors, about the sorts of things that they saw and treated as young doctors or as students. For example, Zhou Zhongying, who lives in Nanjing, recall treating smallpox outbreaks in 1946 and through 1948. He worked with his father and was very involved in a cholera outbreak in 1946. Xian Fengge, also from Nanjing, talked about his teacher, who was famous for treating acute illnesses with fevers, such as pneumonia, cold damage, which could mean typhoid fever or could mean a broader list of things, dysentery, malaria. His results were very good, and he was a very prestigious man. Zhu Liangchun from Nantong told me he became famous as a young doctor because of his treatments for dengue fever, and he could cure the fever, he said, in 3 days as opposed to 7. Ding Ganren is not somebody I interviewed. He died long before I even started studying Chinese medicine, but he is a famous physician from the early 20th century. And if you read about him and his life, you realize that he himself became famous because of his treatments for scarlet fever. And there was a scarlet fever in 1896. So there's a real history of Chinese medicine doctors treating acute infectious diseases. That's, as I discovered through these interviews, has really been forgotten. So this became a big question for me, and I personally was often stunned to hear some of these stories. I had always, as sort of a young medical student, heard that Chinese medicine was good for chronic illnesses, not for acute illnesses. I had watched doctors, time and time again in hospitals using antibiotics to treat any kind of infection. And so I had sort of just absorbed that particular belief. So I was very surprised by these stories. So part of the research project then became to sort of understand, how did Chinese medicine go from being this thing that everyone thought was very fast acting to something that was very slow acting. So if we go to this next slide, we'll see. I think we can break this down. Today I'll just break it down into sort of three kind of key changes that happened to the practice of Chinese medicine, particularly as this transition from the Republican era, that's 1911 to 1949, to the communist era, which begins in 1949. And so these are less, some of them are political, but these are more just sort of social changes that came about because of a lot of things that were going on. But I'm going to talk about sort of what I call the demography of doctors, sort of the population and where they were, the locus of clinical practice, exactly how they practiced, and the nature of their medical training. So let's take that first one. So one really crucial fact in China before 1949 is that the vast majority of doctors in China were doctors of Chinese medicine. So we sometimes forget about that. There is a history of Western medicine, and then China has a very particular history in that there was really very little of it really in that early. There was very little of it in that early part of the 20th century. So in the picture to the lower right, we've got Li Jiren, also a very famous doctor from Anhui province. And when I asked him about these questions of demography, he said, before 1949, 99% of the doctors in the countryside were doctors of Chinese medicine. Another interesting doctor who lived outside Beijing, Guo Zhongyuan, told me, this sort of story. He said there were only one to two doctors of Western medicine in the whole county where he lived. He was in Miyun County, and they had worked as nurses a bit in the army. Then they came home and started a clinic. Their technical skills weren't good, and they didn't have any equipment, not like modern hospitals. They would just listen with a stethoscope. They couldn't treat much less than a Chinese medicine doctor. So in the countryside, so even if there were doctors of Western medicine, we need to think of them probably more as nurses or paramedics or as somebody who's pretty minimally trained. So that gives you a little bit of a feel for the countryside. Just to look at some statistics then, we see that by 1949, there was 38,000 doctors of Western medicine in the whole country. Maybe half of them had graduated from actual medical schools. Maybe the other half were a little bit like those nurses and kind of paramedics that Guo Zhongyuan was talking about. And another significant fact is that a lot of them lived in just one place, and that was Shanghai. So Western medicine doctors tended to really congregate in the cities. There was very few in the countryside, and even in the cities, they were vastly outnumbered by doctors of Chinese medicine, who probably, estimates were, they may have been as many as 500,000 of those doctors. So it gives you a little perspective on the demography there of doctors. When it comes to clinical practice, another really important fact is that doctors worked in private clinics, probably not, probably like many of you do. There was really no such thing as a hospital of Chinese medicine. I mean, there's a few examples, yes, but again, just a few examples, and that's not where most doctors work. And even hospitals of Western medicine were not that common, but they were certainly found in cities, and some of them were founded by missionary doctors, and they often ended up being too expensive for the average person. The picture on the lower right here is the Peking Union Hospital, which was established in 1917, and that's now one of the most famous hospitals in China. But again, that just started in 1970. That gives you a bit of a historical understanding of how recent hospitals are in the sort of medical landscape of China. So if we go on to the next slide, there's one important part of this is that the clinic itself also was related to sort of like the economics of how people went to see doctors and how medicine was practiced. And so one of the important things to remember is that people at the time were quite poor. China was in the midst of a lot of political turmoil and ultimately civil war and war with Japan. And this meant that people are only going to the doctors when they absolutely had to. So Li Jinyong, who's in the picture on the right, very famous doctor from Wuhan, now the center of the coronavirus outbreak, told me, at the time during the Sino-Japanese War, life in the countryside was so hard. Peasants could only afford to take 1 or 2 doses of medicine. We treated only acute diseases. If you didn't get results on 1 or 2 doses, they didn't come back. So another doctor, Lo Dofeng, who lives in Henan, told me similar stories. He said, my father, who was also a doctor, never needed more than 3 doses to cure a patient, and usually the problem was resolved in 1 or 2 doses. On the lower right is a picture of me with a famous pharmacist, Jin Shiyuan, who started practicing pharmacy in Beijing. He worked at what was known as the Fuyou Pharmacy in the early 1940s. And he told me it was unheard of to fill a prescription for 10 doses, as one might do today. The biggest prescriptions were filled for 2 or 3 doses, and usually it was just 1 dose. So this is very different than sort of today's hospital, where you see patients sort of walking out of a hospital with a bag full of herbs for 2 weeks or a month or something like that. So you can see just kind of from the nature of the private practice of the time and the limitations of the financial limitations of the patients, Chinese medicine work was totally oriented to the treatment of acute diseases. Now we want to talk a little bit about also medical training. How were doctors trained at that in this period? Well, to speak in a bit of a generalization here, but we can say doctors were trained primarily through apprenticeships. Now there were some new private schools that were established in this Republican era. They're not quite like schools of Chinese medicine today, whether you, as you might be familiar with them in the U.S. or at school and colleges and universities in China. And one aspect, even in the schools, is that when you got to some of your clinical training, the clinical training itself often follow a little bit more of a master-disciple model, as opposed to sort of like a Western medicine model where you do rounds in the hospital and you go from department to department. And another really important aspect of the training is that students read and memorized, the classics. They had to memorize lots of things. And at the same time, there was little to no training in Western medicine. Even at some of these schools, the training was pretty minimal. And so doctors who knew some Western medicine were essentially self-taught at this period. So that meant there was a very small minority of kind of elite doctors that really knew anything beyond Chinese medicine. Let's now talk a little bit about just how people thought about the clinical efficacy of Chinese medicine in the Republican period, and to give you a little bit more background for changes that came later. So there was a lot of debates about Chinese medicine at this time, particularly among kind of elite intellectuals. And we still have that in China today. There's still plenty of debate about the merits of Chinese medicine and its proper place in society. But here I've got a quote from Lu Xun, who those of you who are interested in Chinese literature would know him as really sort of China's most famous modern author. And here's a comment of him talking about Sun Yat-sen, who was the leader of the 1911 revolution, so a very important political figure that precedes sort of Mao Zedong and Deng Xiaoping and those eras of the leaders of the communist period. And he said this about Sun Yat-sen, who himself was also trained in Western medicine. So he said, after hearing that Sun Yat-sen had consistently refused to take Chinese medicine, and this is for the treatment of liver cancer, he was dying of liver cancer, Lu Xun could not contain his feelings and stated that Sun's decision moved me so much that it is no less important than his lifelong commitment to revolution. So here you see Sun Yat-sen's rejection of Chinese medicine was also sort of an embrace of of a very what was considered an embrace of a progressive, revolutionary agenda to change Chinese society. If we go to the next slide, we'll see that, however, that sort of opinion was the opinion of yes, elite intellectuals, but it actually we have kind of get a very interesting and very different story if we kind of look at what doctors of Chinese medicine themselves were saying. So doctors of Chinese medicine did not think of themselves as inferior to doctors of Western medicine, as they do today. Today, there's a sort of major inferiority complex. And in fact, they thought of themselves as the clinically superior form of medicine. So here's a quote from a doctor that I interviewed in Hangzhou. His name is He Ren. And he told me about his father who had a clinic, and he said this, this is a paraphrase. He said that although his father's clinic was not far from two major hospitals of Western medicine in Hangzhou, and this was the French Shenai Hospital and the British Guangxi Hospital, He Ren remembered that his father really had, these hospitals were not really competition for his father's clinic. He said, my father's clinic was very busy. And he said, that's because most people held Chinese medicine in higher regard than Western medicine. Now, here's a quote from Liu Yanlei, not somebody interviewed, but a famous intellectual from this period and a famous doctor and scholar. And he wrote in 1929, with regards to the treatment of infectious diseases, 9 out of 10 Western medicine drugs are useless, with the exception of the chemical compounds of 606 and 914. Those are old drugs that we don't obviously no longer use today. Today, if you insist on banning Chinese medicine or replacing it with Western medicine, it will be even harder to treat infectious diseases. Now, the context of this quote was there were some officials in the government, again, a little bit more like Lu Xun, who are progressive intellectuals, revolutionaries who wanted to ban Chinese medicine in 1929. That didn't happen. But you can see his retort was from Liu Yanlei is that if you do that, how are we going to treat infectious diseases? So here's a reminder of just how important Chinese medicine was for some of these things. Now I'm going to give you another little perspective on Liu Yanlei, and this relates to also to some research of mine, and this gets to some specifics of clinical practice here too that I'll come back to at the end of this talk. But Liu Yanlei himself was also very partial to a certain particular form of Chinese medicine practice, and very critical of other types. So we can see here in this quote that he's really very critical of sort of what's known as warm illness, or I like to translate it as warm disorders treatments, and very much a fan of the cold damage school. This sort of all originates with the treatise on cold damage disorders from Zhang Zhongjing that go back to almost 2,000 years to the Han Dynasty. So here's a quote from one of his essays. And he, again, writing in 1929, where there was a movement among some doctors of Western medicine to try and ban Chinese medicine, which would be similar to what was done in Japan, half a century earlier. And he wrote, I often hear of doctors of Western medicine attacking Chinese medicine, but I've been unwilling to acknowledge their insolent assaults, believing them too vulgar to debate. So I've usually mocked them with a few ludicrous words, not wanting to waste a day on these types, nor eager to protect the rice bowls of today's so-called doctors of Chinese medicine. The reason Chinese medicine is superior to Western medicine is its treatments. And in treatment, there is nothing greater than Zhang Zhongjing. So again, the author of the treatise on cold damage disorders. Today's so-called doctors of Chinese medicine all follow Ye Tianshi, Wu Jutong, Wang Shixiong. They don't read Zhongjing's books. They don't use Zhongjing's methods. This is hearsay and not the great lineage of Chinese medicine. So now we don't have to totally take sides on this debate, but it's a very interesting debate that I've also written about in some of my academic writings about between sort of the cold damage schools and the warm disorder or the warm illness schools. But I do want to highlight this point that he believes absolutely that Chinese medicine is superior to Western medicine, and particularly because of its treatments. He really celebrates the treatments of Zhang Zhongjing, the author of the treatise on cold damage disorders. I'm going to come back to that point towards the end of the essay, because I think it's also significant for how we want to think about the coronavirus. Now let's talk a little bit about what happened if doctors were so clear that their methods were superior to Western medicine, and these small number of elite intellectuals were wrong in their rejection of Chinese medicine. What happened, and why did Chinese medicine, quote unquote, slow down? Why did doctors turn from treating acute illnesses, which everyone thought they were so good at, including the doctors themselves, and how do they become effective essentially only for chronic diseases? So I've got this is a complicated question. I've got a couple answers. And certainly one thing we need to entertain as an answer is just, did Western medicine, simply surpass Chinese medicine? The 20th century is, without a doubt, a century of amazing developments within the field of Western medicine, emergency medicine in particular. And so many of the things that we sort of take for granted as standard in Western medicine, they really just emerge and often in the last 60 to 70 years. So antibiotics, and particularly in the treatment of acute diseases, so antibiotics being one of them, they really emerged during World War II. Acetylcholamines to maintain blood pressure during shock. Those are very important. Ventilators to assist or maintain breathing when you're, or CTs to make rapid diagnostic assessments. These are all developments that happened, mostly in the 60s and 70s, antibiotics a little bit earlier, so that it made it possible for doctors of Western medicine to really make inroads in kind of emergency medicine. But although we want to recognize the achievements in Western medicine, I think it doesn't totally explain the changes in Chinese medicine either, because Chinese medicine doctors, if they were good at something, you wouldn't necessarily give it up, yet even as you give a share of that pie, perhaps more to Western medicine. So I think there's some important other factors too that led to some changes. So I want to look at these now. And I would say one very important factor is just sort of the role of the Chinese state in the 1950s. One of the things that the communist government did, was to really support Western medicine. Now, they did also help really institutionalize Chinese medicine. Chinese medicine, as we know it today, is very much indebted to sort of the communist commitments to building colleges, and which are now universities of Chinese medicine, and developing textbooks. And so many of the things that you may be learning about in your own schools of Chinese medicine, in some sense, are very much indebted to communist efforts to really build the Chinese medicine profession. But one thing that happened was they put even more effort into building the Western medicine profession. And so if you just look at this sort of chart of the numbers of this is the numbers of doctors of Chinese medicine, you can see that Chinese medicine doctors, I think we get the numbers maybe a little bit misleading. They certainly stagnated. They haven't really gone up drastically. And if we had 500,000 at 1949, they actually kind of go down to something like 350,000 by 1957. Some people argue, well, a good number of those doctors weren't really doctors, or they weren't really skilled doctors. They were more sort of itinerant peddlers of drugs and things like that. They weren't very knowledgeable doctors. So even if we ignore that initial drop in the 50s, we can see that it doesn't go back up and climb in the way that the Western medicine profession does after 1965. So one thing that happens therefore as a result is that the Western profession just becomes much more dominant, much more, and Western medicine care much more widespread and prevalent in Chinese society. That inevitably sort of changes the way patients think about their health care, and the way doctors of Chinese medicine think about what they're doing, because now they're having to always sort of relate it to what might be possible in Western medicine. So if we go to the next slide, we can see that part of this is that we also have a shift from private clinics. Uh, Early in the 1950s, they would make union or united clinics. So the private clinics in Chinese medicine became group practices. Um, but, and the institutionalization of Chinese medicine kind of came by, sort of started in the late 50s and 60s, so gradually start to have hospitals and medical schools. But these seem to be sort of focused in the cities. One effect of that is that it starts to kind of pull doctors out of the countryside. And at the same time that Western medicine is sort of being spread more and more into the countryside. Um, and part of that institutionalization process means that doctors of Chinese medicine also have to learn Western medicine as part of what they do in hospitals. And so gradually what happens that there's just a shifting balance of power here as you have more doctors of Western medicine, but at the same time you have sort of more Western medicine within Chinese medicine hospitals. And you have a profession that's sort of growing more slowly and more cautiously than Western medicine. So when I then sort of asked, if you go to the next slide, you'll see when I then asked doctors, why did you give up, treating acute illnesses if this is what you were so good at? And I got some interesting answers. So for example, Deng Tiatao, who passed away recently in Guangzhou, basically said, the stage was taken away from us. So one thing he pointed to was there was a new medical insurance system in the 1950s. And this was only in urban China, but in urban China, the medical insurance system suddenly made Western medicine very inexpensive for urban residents. So more and more people are going to hospitals. The hospitals were initially entirely Western medicine hospitals or very much focused on Western medicine. And so, the health-seeking habits of urban residents start to be oriented more and more towards Western medicine. Getting an X-ray at a hospital also, is kind of a different experience than having just your pulse taken by a Chinese medicine doctor. Li Jinyong, who I mentioned earlier, from Wuhan province at the center of the coronavirus outbreak right now, he mentioned to me also that in many hospitals, however, the Chinese medicine doctors were simply prevented from being involved in the treatment of anyone coming to the hospital with a fever or some sort of acute febrile condition. And so he pointed out to me that, the result was that basically doctors couldn't, really use their skills in treating acute diseases, and very quickly young doctors sort of weren't learning them. So as these older doctors are turning towards more chronic illnesses and specializing in them, younger doctors are also, not learning sort of these skills in treating acute infectious diseases. So there's just gradual undermining of this what was once a very important strength in Chinese medicine. And so now, were there no acute illnesses and epidemic outbreaks in the early communist era? Yes, there were. So we'll look. Chinese medicine certainly played a role in them. So if we go to the next slide, but you'll see sort of the attitude here. That, for example, there was a famous Japanese bee encephalitis outbreak in the 1950s. And you'll see this director of the Hebei Bureau of Public Health kind of criticizing people for not using Chinese medicine more. He writes, some hospitals have overemphasized the primacy of Western medicine diagnosis before allowing Chinese medicine treatments, thereby causing unnecessary delays in patient care. This is inappropriate. Now that it's been shown that Chinese medicine has superb results in the treatment of encephalitis, I hope that all localities will act in accordance with the spirit of revolutionary humanism, putting the lives of the patient first, working together as closely as possible to help Chinese medicine doctors be efficacious as possible. So you can see in this quote here that already there's some of those institutional and bureaucratic sorts of impediments that that I just mentioned in the previous slide are kind of showing up in the treatment of this, very, very dangerous epidemic that was kind of raging in China in the 1950s. Chinese medicine had a lot to offer, but it wasn't always allowed to sort of offer it. So to kind of sum up in this next slide, I think we can argue that we might say there's something of a paradigm shift kind of in the in the medical world in China. And as Western medicine becomes more powerful, Chinese medicine is institutionalized, but it is also at the same time weaker vis-a-vis its relationship to Western medicine. It then becomes, it starts to define itself. Practitioners start to define themselves by this relationship. And so you can see we have these are, on the right is a couple of very common phrases that you'll hear all the time in China. You'll hear this from doctors as well as from patients, but you'll hear people say that Western medicine treats acute diseases, Chinese medicine treats chronic diseases. But you also hear people say, "Oh, Western medicine, diagnoses a disease. Chinese medicine diagnoses a pattern." Or another common one is Western medicine treats structural diseases. Chinese medicine treats functional diseases. So sometimes those statements are maybe useful to help us think about the differences between the two. But in the overall, I think they kind of reinforce a power inequality between the two things. So Chinese medicine doesn't do, like, Western medicine is good as this really important thing, and Chinese medicine is just going to be good at something a little bit less important. We're not going to do the acute diseases, we'll just do the chronic diseases, not structural diseases, just the functional diseases. As a result, kind of going into the 60s, 70s, 80s, and 90s, there's just less and less knowledge of the treatment of acute infectious diseases in China. So that by the time I was a student in the late 1990s there, nobody that I knew until I met these very elder doctors thought that Chinese medicine was good for anything particularly acute. And you would always need Western medicine, whether it was antibiotics or steroids or something, to kind of make that intervention in an acute process, bring a patient under control, and then you might have a chance to kind of like make a difference with Chinese medicine. Now, there was, however, a little bit of a shift in the early 2000s, and this is because of the SARS outbreak. So let's look at our next slide. And so in the early 2000s, there was what ended up being a bit of a breakthrough, and I think it's leading to very much influencing what's happening in China right now. So SARS is another coronavirus, a good bit more deadly than COVID-19. But when this outbreak happened back in sort of early 2003, there was initially sort of almost a reversion to that sort of 1950 attitude of sort of officials in China, which is like, don't let Chinese medicine doctors get near this. They just they're not scientific enough. They don't have the skills or whatever to understand these kinds of issues. And there was an attempt to sort of really marginalize doctors in the treatment of SARS. But as it turned out, the SARS epidemic was really focused much in the south in China, and particularly in Guangdong province, where there also happens to be a real love of Chinese medicine, perhaps more interest in Chinese medicine in this province than really maybe any other place in China. So the heart of the outbreak kind of coincided with, happened to be located in this place where there was a real willingness to use Chinese medicine. And so Chinese medicine doctors did get involved there. And one of the things they found after it was sort of all over is that actually they did pretty well. So for example, in the Guangdong Provincial Hospital of Chinese Medicine, there was 103 SARS patients from January to April of 2003. 7 of them died, which is a mortality rate not great of 6.79%, but this is, compared to roughly what was about 15% in other places. So they really did better. And what some doctors there pointed out to me is that these numbers are even a little bit misleading, because they don't point out the number of patients that with fevers who were, cured before really a positive disease identification can be made. And they also pointed out there was, among the hospital staff who were all taking Chinese medicine prophylactically, there was no cases of SARS, which is actually not true in other parts of China. So in Guangdong, they really felt like there was kind of a breakthrough. Doctors of Chinese medicine suddenly realized, hey, we can do something here. This is a virus, and there's no Western medicine treatments, and or the things that people were trying, like these high-dose steroid treatments, were having disastrous side effects. And there was something we can do, and that gradually, I think, led to a little bit of a shift in attitudes. And so I think today it's the status of Chinese medicine in China is still debated today, but we see much more, a much wider use of Chinese herbal remedies in China today for the coronavirus. So let's talk. So now that we've got this history and we've got this understanding that in China, doctors of Chinese medicine are realizing that they actually have some of the tools that are precisely the thing needed for like an epidemic like this, and they're finally sort of coming into play in this particular one, which is very exciting. Let's talk a little bit about sort of what we can do here in the U.S. as this pandemic is coming to the U.S. and what can we do for patients, and how can we also help you as individuals and also your patients to stay healthy during this epidemic. So for sure, Chinese medicine can be helpful here. And so I think we want to think about two things. First, we want to think about prevention, and then we want to think about treatment. So let's take prevention first. That's kind of the easy thing. What we're learning about COVID-19 is that it seems to affect the elderly and the immunocompromised the most, and it's the most lethal for these individuals. And in fact, children seem to do quite well with it, and may only get very mildly sick. So you probably all know the sort of the standard sorts of things, washing hands and avoiding unnecessary travel and minimizing contact with large groups of people. But particularly because COVID-19 is so dangerous for these more elderly, vulnerable populations, this is a good chance to really use some Chinese medicine preventively. And Yuping Feng San, which you may know as jade windscreen, at Dow Labs we call it immunity support, is really an excellent choice. And so you may know this formula, and those of you who have used it before, you'll know that this formula is designed specifically for patients who get frequent colds. They get colds because there's basically a qi deficiency, particularly a defensive qi deficiency, and they're getting frequent colds. So I've long before coronavirus, I've used this formula innumerable times for patients in this situation, and it's really kind of amazing to see them turn around. So the patient who's getting sort of every bug that comes around suddenly stops getting sick. And so for those of your patients that are more elderly or immunocompromised, this is a great formula. It supplements qi, it fortifies exterior, it dispels wind. And this is going to give, this is sort of like, I think, the go-to formula for people who are looking for a little bit of something to do while they sort of sit at home and try to not get sick. Now I would say it's, maybe not a universal prescription, and for your patients with more complicated medical histories, I would say mostly keep doing what you're doing. Do the things that you need to do to make them as healthy and balanced as possible, and that's going to be immensely helpful to helping them not get sick with COVID-19. So for example, if you've got a patient with serious digestive issues, I wouldn't just stop and switch to Yuping Feng San. I'd keep working on those digestive issues. That's going to be precisely what is going to help this patient be as strong and as robust as possible, and prevent them from getting sick. So that's a little bit on prevention. What about if you encounter a patient and you've or somebody in your own family gets sick? What should we do? Well, here I don't have any experience with the coronavirus, so but I'm going to tell you a little bit about how I approach just upper respiratory tract conditions in general. And I think we can draw on some of those doctors from the Republican period, like Liu Yanlei, who I mentioned before, who really emphasize the superiority of formulas from the cold damage tradition, from the treatise on cold damage, or treatise on cold damage disorders. At least in the treatment of sort of upper respiratory tract infections, I really find this advice extremely helpful. So what you're going to need here are sort of, and here we're talking about maybe designing your own formulas, either with granules or with bulk herbs. But what you really need are those pungent dispersing herbs to drive out wind, but often I think we want to drive out cold too. So one of the debates in the Republican period is, do we want warming or cooling herbs? And here I think we want more, you may want more warming herbs than you realize. So the warm exterior, and the reason is because warm exterior releasing herbs in general are more powerful than the cold exterior releasing herbs. That's not something we're necessarily taught in school. Um, but that is kind of true in clinical practice. So mint, for example, is a cold exterior releasing herb. It does not have the, it does not have the dispersing properties of something like a ephedra or cinnamon twig. So what I think you want to do here is look for formulas that are more in that Changhan cold damage tradition. Ephedra decoction would be great if, for somebody who really got sick with like a pneumonia. Cinnamon twig decoction wouldn't be quite as powerful for that, but those sorts of formulas really can guide us here. And so you might want to consider something, I think, and I wouldn't do exactly these formulas either, but these are more in the vein, something like ginseng powder to overcome pathogenic influences. This is Renshin Baidusan. Or Qingfeng Baidusan, I can't pronounce the English title, the English name here. Schizophrenia and Sapochnikovia, powder to overcome pathogenic influences. Those are more, I think, in the vein of what you probably want to do. And the little I've been hearing from treatments in China is that these things, those sorts of formulas might be good, and there's, I think, dampness is also, in addition to cold, is an important factor here. So you might want to really deal with, help to think along those lines. At the same time, if we go into the next slide, I think one of the lessons of those Republican era doctors too is to be a little bit cautious of those cooling herbs. And the reason is that they can drive pathogens deeper into the body. So for example, honeysuckle and forsythia powder. I know this is an extremely popular formula, yin chao san, and I use it a lot myself, trust me. But this might be something to be a little bit cautious about here because it is a very cooling formula with not a lot of dispersing power. It's great for wind heat conditions, but I think maybe more like a tonsillitis, I would be a little bit nervous. This is just sort of my opinion here. Again, without having seen COVID-19 personally, but this would be sort of how I approached it. I'd be a little bit nervous to kind of go with this particular formula. Even if I saw signs of heat in a patient with COVID-19, I would perhaps use some of those herbs. I might take yinhua, I might take lianqiao, honeysuckle, I might take forsythia and use them, but I might put them in a formula with more warming exterior releasing herbs so that those cooling properties help clear heat when necessary, but I still have those strong dispersing herbs to help drive out the illness. So that would be my approach. And so, and I think this goes together with the sorts of reports we're getting on COVID-19, in that it tends to be mild in younger, healthier individuals, and it only becomes dangerous when it moves into the lungs. And so that suggests to me that we want to be careful about cooling herbs, which might do precisely that, drive that virus, drive that pathogen, drive those pathogens into the lungs. So that's why I think you want to, if you feel it's important to use heat clearing herbs, make sure you balance it with the warm dispersing herbs. You're probably not going to be able to get ma huang, but certainly guizhi, those herbs are going to be very useful, I think, and qianghuo, duhuo, those herbs I think could be very useful in treating a COVID-19 infection. Hopefully you never get there, but anyways, you want to be kind of aware. And by the way, this advice is just sort of, I think, general advice for dealing with kind of most upper respiratory tract infections. I find just the warm exterior clearing herbs to really be your best friends in these situations, at least for the things that we tend to see in our clinical practice or in our everyday care. These days, we don't necessarily have quite the same kind of conditions that maybe a doctor of warm illness disorder, or warm illness or warm disorders who would be treating back in maybe the early 20th century. So those are a few of my tips for how to think about COVID-19, what to do, and both preventatively and in terms of treatment. And also just sort of like a bit of a history lesson for us to understand that there are real solutions in Chinese medicine. I think we really know this now from this research and from the history of how Chinese medicine was used even as recently as sort of like the mid 20th century. And I think we're seeing an important shift in China these days. So we'll learn more about this as things progress. In the meantime, everyone stay safe and be careful, and wishing you all the best health in the coming weeks. And hopefully we all can get through this together and with a minimal harm and illness to the people around you. Thanks very much.